In this video, I'm going to be showing a little bit about bone segmentation using Blue Sky Plan. Now, let me preface right up front that this is a tedious process. A lot of people do this and then find it's just not worth the time and effort to do it, because to do a really good job, it requires a lot of effort. There's just no way around it. So let me show you at least what I would suggest you doing. For most people, using image 3D conversion, I've had great success using them. They can do individual tooth segmentation as well as the jaws, any number of things like that. They can help with treatment planning. So if you're trying to do a lot of these bigger cases and you don't have the time to sit around and segment bone, highly recommend their services. They've done an excellent job. Now, with that said, a lot of people still want to know how to do this, and so I can show you a few little hacks and tricks that might make this easier. So let's go ahead and do that. So first thing I'm going to do is isolate the lower jaw, which in this case we're going to be segmenting. So click isolate, click on the mandible. That should make everything else disappear. So now I have an isolated mandible. And if you look at the rendering of this, I'm going to look at where we are right this moment. So about 1770 is what the 3D rendering is set at. If I was to drag this up, you can see that it gets even more porous. If I go more to the right, it looks like it's physically growing a little bit, and then it starts to get grainy before it finally just kind of washes out. So let's go back to where the software originally had it. However this slider appears, or the density appears in the slider menu, that's what it's going to do. So let's go over here to Surfaces panel, select the CT, create model. And this is the result. The software simply takes that and turns whatever the rendering was in the DICOM data into an STL. So quick, easy, just the push of a button, and we get this. And if all you were going to do is print this out to do a practice surgery on, or just to help do some case planning, things like that, this can work really well. But if you were trying to make a surgical guide on this, so let's say we were making a bone guide that will sit directly on top of this mandible for making osteotomies, that is going to be problematic, because if you look at the density of this, it's full of porosities. Okay, because all the software is doing is it's looking at this data and it's saying, okay, everything of such and such density and up, we're going to call that bone, we'll circle it, we'll turn it to STL, and then everything of that density and below is not bone. But for our purposes, when making a surgical guide, if you look in this slice, we want to consider this bone, right? Even though it's interior in here, that is still bone. And if we make a surgical guide directly onto this surface, it's going to drop down into every little nook and cranny that you see here on the crest, and the resulting guide would not fit, because when you take it to the mouth, that is physically bone that just didn't get picked up by this method of segmentation. Okay, so nothing in life is ever that easy, so we're going to have to instead go through the process of real segmentation, which is found up in your panels, segmentation, and we're going to do advanced jaw segmentation. Okay, so it's going to lead you through a wizard. Click next. Oh, I need to first define the area. So first of all, if I look at this model, really all these areas where there were dense cortical boundaries, it picked it up pretty well. There's no need to go back and refine all of those, because software did a great job of it. So I'm going to outline pretty much just the crestal area, you know, the places where there was extraction sockets and things like that that might have been missed. Then I can click next. And what the software will do is lead me through a menu. As you can see, it's going to take me through 11 slices where it wants to segment this information. And so I can use the intelligent lasso. Intelligent lasso is going to say, okay, everything of this density and higher is bone. And then we need to go back and manually define for it, hey, this is also bone. This is also bone. And if you get a continuous red boundary, you can just say fill holes. So now we're telling the software all of this is bone, not just the stuff outlined in yellow, but all of it. Next, intelligent lasso. And if you think about this, with what we're wanting to do with building a guide, we would rather have the bone be a little bit over contoured than under contoured, right? Because any place that it's under contoured, the surgical guide is going to not seat. Whereas if it's a bit over contoured, that'll be a little area where there's maybe a gap between the two, but you're going to hopefully be accurate enough everywhere else that that won't necessarily matter. So again, is that all bone? I'm not 100% sure that it is, but I would rather over contour it than under. And next, intelligent lasso. So we're just going to go through all of the slices that it takes us through in this wizard workflow. Fill the holes. Now that we've gone through all the axial slices, you can see each of those axial slices we defined is represented by one of these red lines. Now it's going to take us through cross-sectional slices. Exact same process. We're going to outline it. It's going to highlight those areas, and then we need to brush in and fill the areas where we might have missed, fill the holes, and we're going to repeat this process throughout all of these slices. Okay, so we've defined all of the 11 slices, and so it's saying, hey, you only did so many of these. You sure you want to continue? I think it's advisable, if you're wanting to get the best result on this, to go back and add some more data. So I'm going to go to the MPR view, and this is going to allow me to look at some more slices, and I can just slice through this. Right at the crest is where it's always going to be problematic. So I would suggest you go back and you define some extra slices right on the crest. So I can use my lasso. I want to erase that radiographic marker there, brush in some of this thicker stuff. Oops. Let's go back and grab that. Fill holes. And then I can just use the scroll ball on the mouse to continue adding a few more. So intelligent lasso, I can see with the jaggedness of all these boundaries, that's probably not going to segment all that great. So let's add a little bit more data to that. Let's come over here, add just a bit here. Fill the holes. Scroll a bit more. That's not going to segment all that good because, again, it's going to be really jagged appearing. So I'm just adding more data to try and smooth this thing out and to make this more watertight. And again, I don't care if it's a little bit over contoured. I really do care, though, if it's under contoured. That's going to be a problem. You can change your brush size if you want to. Eraser. Fill the holes. And then we ought to define some right here on this area of the crest. Okay, so we're going to roll with this. I'm going to click next, and it's going to take me through those extra 4 slices or so that I went through, and we're just going to go with it. Next, yes. So now the software is going to perform the segmentation the best it can based on those slices that we defined. And now we have the completed segmentation. You can see it's represented here by the white over here. And so everything that's showing up pink in this outline, it's saying is bone. Now, is it perfect? The answer is no. Remember, we only did about 15 slices here, and so you can see that there's areas that it missed. That should be bone. Now, how could we address that? One, we could go back to previous, and we can define a few more. And so if I scoot back a little bit, view, perspectives, I can go find that. Oops, let's go to view. I like NPR when I'm doing this. So I could try and find that little area that was missed right here, and now let's go and add more data to this. So intelligent lasso. Also define in the exact same slice here. Okay, so I've added more data to there, and I could even come back and maybe define another slice or two that I know it didn't capture. So you can analyze this data based on those outlines. Where did it miss? What can I go back and add? And if you need to in certain areas, you can come back and add it before you finalize that segmentation. Now this is relatively easy on a mandible, right? Because mandible has these dense cortical boundaries. You use that intelligent lasso tool and it captures most of it and it turns it to bone. Where this really gets difficult and gets to be a pain in the butt is if you're trying to do this on a maxilla, because a maxilla is so porous throughout the entire thing that you can really spend a lot of time going through this process. And that's where especially image 3D conversion comes in really nice, because a maxilla, I'm just not going to spend the time to do it in most cases. All right, let's look again. Let's see if this time, if things are looking a little better. So everything in red is going to be considered segmented bone. And I'm liking how it looks overall, but there are still little missed areas, right? So it's such a pain in the butt because you've got to continue to go back and fill this in. Now, here's where one of the hacks come into this, is that we're just going to say create a surface out of this. So everything that it turned pink, let's turn it into an STL surface. All right, so now you see that has turned brown. I'll make it a little more visible color, like a blue. And so here's where one of the hacks can come into play, is that you're going to have areas where your blue model captured it and your yellow one missed it, right? If you look here, the blue captured it, yellow missed it. But then you're also going to have areas where the blue missed it and the yellow captured it, like right here. And so if we could combine the best parts of both of these models, we would probably end up with a really nice overall model. So I'm going to go to File, Export Data, and I'm going to export both of these surfaces together. I'm going to name this Combine These. And so it's going to export those as a single STL. Now if I minimize it, I can open up that model in Meshmixer. There's other programs you could use, but Meshmixer is the one I'm familiar with, so that's what I'll show here. And here we have those two models combined into a single STL, but they're still kind of segmented into their component parts. Like right there, you see the orange. That is all the initial segmented model. The rest is going to be the one where we just pushed create model. So what I want to do here is I want to just turn this into a solid model. Okay, so edit, and let's make solid. Now, I'm not going to worry right this moment about the accuracy of this model. This is a poor quality segmentation. I know it is. I don't care. Let's save it and let's export it. File, export. And I'm going to call this crap jaw, because it's still a crap segmentation at the moment. I know it's got complex objects. All right. Now let's do this. Let's close that. Don't save it. Let's open the crap jaw. Let's see if now, just sometimes this is finicky and it just wouldn't let you do it. Now, for whatever reason, I can select all this. There we go. I'm going to get all this external border. Let's delete. Let's analysis inspector, and let's close that one hole. There we go. Done. Select this, and then invert, which will deselect that and select anything else. And if I push delete, now it should get rid of it. Okay, clear that selection, analysis, find any issues. There are none anymore. Perfect. Now let's import and append. Remember the original, combine these. Let's get that again. It's going to overlay it. And what I've done is I've just more or less made a big solid internal to this. Okay, and now I'm going to control, select, and combine all of these into one model. Okay, now this time let's make solid again. You're going to get some spikes and things, that's okay. Let's go instead to accurate. Let's go to maximum solid accuracy and also increase the mesh density to halfway. Update. Okay, great. So this is the final resulting model. You see how there's no porosity in it, there's no nothing. Accept that, and let's now call this our final jaw. Export it. It should have nice accuracy. Save that. And let's pull that back into Blue Sky Plan and just analyze it a bit. So import STL. As long as I didn't mess up the orientation outside of Blue Sky Plan, then I should be able to import this and it still be in the proper orientation. So when it comes up asking you to stitch, just cancel. And now let's look at our segmentation. So if I scroll through this, I'm not seeing any areas missed. This is looking really nice. Even little sharp spicules of bone that we missed initially, it seems to have captured all of those. And remember, it just accomplished that by kind of condensing models onto one another. Okay, sorry, I had a quick phone call there. But what I was saying was, now that you can see the final segmentation, all I've done is just condense all these models together, and it kind of captures the best of all the scenarios. So sometimes the one where you just push create model, that does actually a really good job of capturing little spicules of bone and little parts sticking up that you might miss in segmentation. But it obviously doesn't make a solid model. So the other methods that I showed you to actually go through segmentation and then just condense those all into one solid model should allow you to come up with a nice segmentation like you see right here. You can make bone reduction guides on this. You can make whatever you want on this. And inevitably, there's always going to be some little spot on the crest that you might miss because, frankly, you're eyeballing this. So if that's the case, it's always going to be a little piece of not very dense spicule of bone or something. Always wise, when you first lay these big flaps, get a bone file and just really scrape over the surface so that you scrape off any little pieces of bone like that may not be showing up very well for segmenting, but that potentially could cause a prematurity that would keep your guide from fully seating. So that's how you do it. As you can see, it is a bit tedious, but it can be done. My real time on this, if I'm doing it and not trying to talk through everything, to do one of these on a mandible is probably going to be 15 to 18 minutes or so. To do a maxilla, it might be up to 30. And so maxillas, I usually will farm those out to image 3D conversion just because it's worth the time savings to do that. But anyways, I hope you found the video helpful, and let me know if you have questions.